After being quarantined for weeks on a cruise ship off the coast of Japan, 13 Americans are now isolated on the UNMC campus. Good evening, I'm Jennifer Griswold. They arrived this morning and either have the coronavirus or are at high risk of testing positive. Reporter John Kipper joined us from the newsroom with the latest on the testing being done here in Omaha. John?
Yeah, Jenny, UNMC and Nebraska medicine officials say that some of these people here tested positive for the coronavirus before they left the United States, but they had no documentation, so officials tested them all again when they arrived in Omaha and are currently waiting to hear just how many have the illness. After being stuck on a quarantine cruise ship for well over a week, 13 Americans are now in Omaha, quarantined again.
We really had an ideal venue for these individuals to come here for their observation and care if needed. 12
of them are being quarantined over at the Davis Global Center, individually placed in a hotel-style room where they're routinely monitored. One of them is in a different building, being transported into the biocontainment unit where they'll receive more intense care.
The patient that was transported to the biocontainment unit had some lightheadedness, had a mild cough, had a fever that was documented before landing, and also had a chronic condition which could complicate the issue if he were to test positive for coronavirus.
Once the testing is done and they have a full scope of how many officially have the illness, they could readjust the patients, with more potentially going to the biocontainment unit, while others could get more freedom.
We'll still have to decide, based upon the mix of folks that we have, whether or not they'll have to stay in their room or if they could actually, I don't know, walk the hall or whatever.
Nebraska medicine and UNMC officials also say that the public in and around Omaha is safe. All patients' rooms have special air filtration systems, and hospital staff is very well prepared.
All of the healthcare workers involved in this mission are very skilled, and we practice and train and teach on these topics related to infection prevention and control.
Now, some are asking, who is paying for all this extra expense? Officials at the news conference say they have a contract with the federal government, and it's federal money that is covering the cost. Reporting live in the newsroom, John Kipper, 3 News Now.